We've all heard the stories of someone who lost everything to addiction, of a loved one who was in and out of rehab, of a person who battled depression and also drank to numb the pain. Behind these stories lies a reality that's more common than many realize. The reality of substance use disorders and what's known in psychiatry as dual diagnosis. What does that mean? Why do addiction and mental illness often go hand in hand? And how do we treat them together, not separately? In this video, I'll break down what substance use disorders really are, what dual diagnosis means in clinical terms, why it's so common and so complex, and how psychiatry approaches treatment. Whether you're a healthcare professional, a person in recovery, or someone supporting a loved one, this is for you. Let's begin. What is a substance use disorder? A substance use disorder, SUD, is not about weakness or lack of willpower. It is a medical and psychiatric condition involving the compulsive use of a substance despite harmful consequences. Substances can include alcohol, cannabis, cocaine, methamphetamine, opioids like heroin or prescription painkillers, benzodiazepines, hallucinogens, inhalants. The DSM-5 outlines criteria to diagnose SUD based on patterns of loss of control, craving, neglecting responsibilities, continued use despite problems, tolerance, needing more to get the same effect, withdrawal, getting sick when not using. Severity is measured as mild, moderate, or severe depending on how many criteria are met. But here's the key idea. Substance use disorders change the brain, and they often emerge alongside or because of other mental illnesses. That brings us to the next term, dual diagnosis. What is dual diagnosis? Dual diagnosis means someone has both a substance use disorder and another mental health condition. Other terms include co-occurring disorders, comorbid psychiatric and substance use disorders, concurrent disorders. Common combinations include alcohol use disorder plus depression, opioid use disorder plus PTSD, methamphetamine use plus psychosis, cannabis use plus anxiety, cocaine use plus bipolar disorder, benzodiazepine misuse plus panic disorder. Some people turn to substances to cope with mental illness. Others develop mental illness because of chronic substance use. In both cases, the two conditions interact and make each other worse. How common is dual diagnosis? Very common. According to the National Institute on Drug Abuse, nearly 50% of people with a mental illness will also experience a substance use disorder, and about 50% of people with a substance use disorder have had a mental illness at some point. It's a two-way street. People with anxiety or depression may self-medicate with alcohol or cannabis. People with trauma may use opioids to numb emotional pain. People with psychosis may turn to meth or hallucinogens, worsening their symptoms. People with ADHD may misuse stimulants. That's why effective care must treat both, not just one. The vicious cycle. How mental illness and addiction feed each other. Imagine this scenario. Someone is struggling with severe depression. They feel hopeless, empty, disconnected. They drink to feel something, anything. At first it helps, then it becomes a crutch, then it becomes a dependency. Now they're depressed and dealing with alcoholism, and the alcohol worsens the depression. This is the cycle of dual diagnosis, and breaking it requires more than just willpower. It requires understanding, support, and medical care. Challenges in diagnosing dual disorders. Diagnosing dual diagnosis is often tricky because substance use mimics psychiatric symptoms. Meth can cause paranoia like schizophrenia. Alcohol withdrawal can cause anxiety or hallucinations. Cannabis can induce panic or confusion. Psychiatric symptoms can drive substance use. Is the person drinking because they're depressed? Or are they depressed because of alcohol's impact on their brain chemistry? People underreport one or both issues due to stigma, shame, or fear of judgment, or because they genuinely don't see a problem. That's why psychiatrists take time to gather history, observe patterns, and sometimes wait until a person is sober before making a firm diagnosis. The role of psychiatry in dual diagnosis. So where does psychiatry fit in? Psychiatrists are trained to identify and diagnose co-occurring conditions, prescribe and monitor medications, provide or refer to psychotherapy, coordinate care with addiction specialists, educate families, reduce stigma, prevent relapse. Let's break that down further. 1. comprehensive evaluation, psychiatrists ask about substance use history, type, duration, patterns, mental health history, depression, anxiety, trauma, etc., medical conditions, family dynamics, legal or occupational issues, previous treatments. They build a timeline to understand what came first, what's driving what, and how to help now. 2. Medication management. Psychiatrists may prescribe antidepressants for co-occurring depression, mood stabilizers for bipolar disorder, antipsychotics for schizophrenia, anti-craving medications like naltrexone or acamprosate for alcohol use, buprenorphine or methadone for opioid use disorder, sleep aids or anti-anxiety meds used carefully to avoid misuse. Every prescription is weighed against risk of dependency, drug interactions, and stability of the patient. 3. Therapeutic interventions. While psychiatrists may offer therapy, they often work alongside addiction counselors, psychologists, social workers, peer support groups. Therapies used include cognitive behavioral therapy, CBT, motivational interviewing, MI, dialectical behavior therapy, DBT, trauma-focused therapy, 12-step facilitation. The key is to treat both the mental illness and the addiction in parallel, not sequentially. 4. Harm reduction and realistic goals. Recovery is not always linear. Psychiatry supports harm reduction approaches, safer use relapse prevention planning, reducing stigma, helping people where they are, not where we want them to be. Why traditional models often fail? Historically, mental health and addiction were treated separately. One system for psychiatric care, another for addiction services. Patients were told, get sober first, then we'll treat your depression. You can't be in this program if you're still using. This fragmented approach fails people with dual diagnoses who need integrated, compassionate care. The new model is integrated dual diagnosis treatment, where both conditions are treated together. Teams communicate, recovery is personalized, relapse is seen as a learning point, not a failure. What recovery looks like, recovery from dual diagnosis may involve medication, therapy, support groups, housing stability, employment assistance, spiritual growth, new relationships. It's not about fixing someone, it's about supporting healing over time. Recovery is possible, people rebuild lives, families reunite, purpose is rediscovered, but it takes time, and no one should walk it alone. What you can do. If you or someone you love may have a dual diagnosis. 1. Don't wait for rock bottom. Early help leads to better outcomes. 2. Look for integrated programs. Not all providers treat both conditions. Find one who does. 3. Be honest with providers. They're not here to judge, they're here to help. 4. Build a support system. Recovery requires connection, family, friends, groups, mentors. 5. Expect ups and downs. Relapse doesn't erase progress. Every day sober, every therapy session, every honest conversation, it all counts. Final thoughts. Substance use disorders are not moral failings. Mental illness is not a weakness. And having both doesn't make someone broken, it makes them human. Psychiatry doesn't promise quick fixes, but it offers a path, a plan, a partner in recovery. We meet people where they are. We help them understand their minds, their cravings, their pain, and we work together to build something stronger in the aftermath of struggle, because behind every dual diagnosis is a story of survival, and behind every story is a person worth saving. If this video helped you understand dual diagnosis, please like, share, and subscribe. Drop a comment. What would you want mental health professionals to know about your experience with addiction and mental illness? Until next time, take care of your mind, and remember, recovery is possible, and you're not alone.